Hi and welcome to Live Well. I'm Amanda Goings. June is National Aphasia Awareness Month, and aphasia often affects victims of stroke or other sudden traumatic brain injury. Now, about 1 in 250 people experience aphasia in their lifetime, and many people don't know what it is, but it is a language impairment that affects the expression and understanding of language, both in speech and writing. And here to discuss that with us today is Dawn Westfall. Dawn is a language speech pathologist at HealthSouth Rehabilitation Center. Thank you for joining us today, Dawn.
Thank you for having me.
Now, tell us a little more about aphasia and what exactly it is.
It's a general term used for any language impairment that is caused by a neurological disorder. And there are many different types of aphasia, but generally they fall into 2 categories: expressive and receptive.
Okay, now tell me what is the difference between expressive and receptive?
With expressive aphasia, the person has difficulty expressing themselves, coming up with the words, making sentences. In receptive aphasia, the person has difficulty understanding someone else's language, so they can't follow directions, things of that nature.
Okay, now it sounds like you're kind of touching a little bit on the symptoms of aphasia, but tell us a little more what the symptoms and signs of this are.
Well, someone would have difficulty maybe following directions, or they may not be able to read, they may not be able to write, they may have difficulty coming up with their words, knowing what to say, how to express themselves. They may not be able to name objects or know what objects do.
Now, I want to be clear, aphasia is a language disorder, not a speech disorder. Now, oftentimes after stroke, many people experience numbness and difficulty, moving their mouth correctly, but this is not that. This is actually something deeper, right?
Right. I mean, a lot of times they accompany each other, so they might have both, but the aphasia is actually the language component of it.
Okay, now, because this is kind of, like I said, a deeper thing, is it possible for family members or friends and loved ones not to realize that their loved one has aphasia?
Sure, because there are different levels. I mean, aphasia can be anything from a very mild impairment all the way up to totally not understanding or not being able to talk. In the mild levels, people might not be extremely aware of it.
Okay. Now, if a family member does have is suffering from aphasia, how should they approach this, or what are the things they can do to kind of help overcome or get around that?
One of the things you want to do, especially if they have expressive aphasia and they can't get their words out, you want to give them extra time to think of what they want to say. Try not to speak for them. You don't want to take that away from them, although they might need some help. In the beginning stages, they might need help with like ordering in a restaurant or things of that nature, but try to let them do as much as possible and give them extra time.
Okay.
And the same thing with with receptive. You want to give them extra time. You want to keep your sentences short, not give them too much information at a time. Give them time to process it.
Okay. Now you're talking about the things that happen kind of at first. Now, is this usually temporary or can it be permanent? What's the time frame usually for this?
Well, as I said, there's different levels and different degrees. So sometimes it can go away completely and the person gets, complete recovery. But oftentimes it's something that's ongoing for a lifetime. The person will get better over time, but it might be something that they have to contend with for a lifetime.
Okay, now obviously HealthSouth Deaconess Rehabilitation Center has a lot of different options and therapies, and you guys have a therapy program for speech impairment. What's so special about HealthSouth's approach to aphasia?
I think one of the things that's good about our approach is that we are very much into individualizing it for each person. As I said, there's different degrees, there's different types, there's different levels, and so we want to make sure that each person's therapy is planned specifically for them. We also get the family involved. We try to get the family to come into the therapy so that they can see what we're doing, so that they can then carry that over at home.
Okay. Now, we actually had the privilege of spending time with one of Dawn's patients, a man named Larry. Now, can you tell us a little bit about Larry's program and how he's progressing, what you guys are doing to help him?
Sure. Larry is a wonderful individual. When he first came to us, he had difficulty even giving us basic biographical information. He couldn't tell us his name, how many children he had. Even those types of things were difficult for him. And now he's up to complex sentences. He's able to sit and we have some wonderful conversations, and he's doing very well. So now we're trying to get him into more of the functional routines, like talking on the phone, because he has children that he likes to talk to on the phone.
Great.
Trying to get him to order at a restaurant, those types of more functional activities.
Well, obviously, it sounds like the individualized program is working very well for Larry. If somebody has a family member or loved one that is suffering from aphasia and they'd like to contact HealthSouth Deaconess, how can they do that?
They can just call us and let us know the symptoms that they're seeing, and we can tell them pretty much over the phone whether or not we feel like that's something that we could help them with. Or they can just go directly to their doctor, and they will need a doctor's order. Okay. And the doctor just simply writes an order for speech therapy. They come in, and we can get them scheduled.
Okay, great. Now, is there anything else you'd like everybody to know about aphasia or aphasia awareness?
Just to understand that they're still human beings. They're able to think. Oftentimes, a person with aphasia knows what they want to say. They just can't get it out. We've all had that feeling where you have the word and it's right there on the tip of your tongue, but you just can't get it out. These people deal with that, you know, multiple times a day or multiple times a sentence sometimes. And so just give them extra time, but also let them, you know, be who they are and try to get their words out.
Okay, great. Well, thank you for joining us today, Dawn.
Thank you.
And thank you for joining us today with Live Well. I'm Amanda Goings, and we'll see you next time.